It is 12:05 here on Saturday afternoon. Dr. Luigi Nally is his name. He is Dr. Lou, and the Dr. Payne Show is here. We are ready to take this next hour right to you. The number 416-870-6400 star 640 on sale. You have concerns, physio concerns, anything to do with your health and the human body, for that matter, is what we cover here in the show. Right? How are you, pal?
Good. Yourself?
Good. How was the week? The week that was.
It was very good. We had actually following the show last week. We had quite a few calls and quite a few people that turned into patients that came to see me.
Wow. Okay.
One story actually sticks out in particular because all of them were kind of the same end result, but this one kind of really hit home for me. I saw this patient who about a year and a half ago had developed something called foot drop, which is essentially where you lose the ability to bring your toes up. It's the L5 nerve root, the motor component.
Does your foot actually...
Yeah, it just it does exactly that. It's a foot drop. So you can't actually bring into what's called dorsiflexion, so your toes pointing up. So when you walk, you hear kind of a steppage type of gait. She woke up that way. She had no idea what was going on. She obviously went to follow up with her family doctor, got the imaging she needed of her back. What they end up finding was that she had some type of a disc herniation putting pressure on that nerve root, causing that foot drop. She has the surgery to remove the blockage on the nerve, and her motor component to that comes back. However, following the surgery, I guess I don't really want to go into specifics on exactly what they did with her, but they did do some things that basically thereafter caused other problems to start occurring. And she's sitting there telling me that, her leg will just start going into massive spasms and spastic twitches. And I'm sitting there hearing her, and I'm not sure that I even believe the way she's describing it until she starts showing me a video of this. Then I see the video and I'm less skeptical because it's like, wow, there's something clearly going on here. And then all of a sudden, as we're going through our assessment, she says to me, it's going to start right now. I said, what's going to start?
She can feel it coming
on. And it starts coming on. And I'm watching this happen, never seen anything like it. I've seen spastic twitches, but this one was the worst that I've ever seen. And I'm looking at it and doesn't make sense to me. This is crazy. And I even try to distract her and get her to snap her fingers, clap her hands, see if, maybe if it's something she's cognitively trying to do, maybe I can distract her. Doesn't miss a beat. This is truly pathology going on. I ask her, have you had any imaging of your brain? Because when you see something like that, you start forgetting about the peripheral nerve. You start thinking more spinal cord or into the brain. And she says, no. And I've been asking my doctor for a year and a half, and I was sent to a neurologist, and the neurologist turned around to her and asked her if she had MS. And her response was, well, why are they asking me? Shouldn't it be their job to maybe figure this out?
Yeah.
And so, I spent the average time that I spend with all my patients for the assessment, because I really do think that's the key. In order to have the right treatment, you have to have the right assessment, is an hour. Which, when you think about it, that's this whole radio show. This is how long I would spend with any given person going through a full history, a full physical exam. And my basic recommendation to her once she was done was that she needs to have some type of brain imaging. And now she has me on her side to fight for it. The problem is sometimes the family doctors, the people that you're seeing, start to become dismissive of this type of pain. Because again, going back to pain being so subjective versus objective things like, if you have cancer, you'll have cancer markers, versus if you have pain, it's very subjective to the individual. And a lot of times these healthcare professionals start to be dismissive of this. And in being dismissive, they sometimes miss these things. And that was just one example of something that I was able to catch. And, we're going to see what imaging reveals for her, and hopefully we'll get her the help that she needs.
So you haven't got a result yet? You don't know exactly
Not
what's
right now, no.
To. Yeah.
And
what are you suspecting?
I'm suspecting something neurodegenerative in nature, and by neurodegenerative, that could be something like an ALS, an MS, something going on in the brain that's affecting her motor system.
Now, would that wouldn't have caused a drop foot, though? That was a problem in the actual spine that they fixed, no?
Yes, maybe no. The thing you hear is people forget that you're allowed to have more than one problem going on in your body. A lot of people forget that, it's not just you have this and therefore you'll be clear of every other disease. The world doesn't work that way. You can have something going on that may be related to something more serious, or it may just be coincidental that you got something like a foot drop and also had this going on. So it's hard to say a lot of the times. And, one of the other problems that this lady's life started to fall apart following this, because she was very successful at her work, and she's unable to work now because she's on disability. And so it's a big spiraling effect, and it's sad. It's sad to see how pain can. a lot of the times when I teach my students, I'm also a teacher, and I am teaching the next wave of chiropractors that are going to come out. I relate this type of pain and these types of stories to stage 4 cancer. This is stage 4 pain. This is when it's gone so long that you're at the end, and it starts to be a big spiraling effect in your life. It starts to get very negative. It can be very hard for these people, and it is very hard for these people. And you know what? That's why you can't ignore the stage 1, the chronic little aches and pains, the repetitive strains, because you don't know when it's going to start progressing. You have to do the right things early in order to eliminate that potential of it going that far.
Anytime, either during or outside the show, you need to get a hold of Dr. Lou. It's simple, 1-855-55-Dr. Lou. That's DRLOU, Dr. Lou. Your phone lines are right open. We're taking your calls. Pain concerns, that is the focus of the show. We'll get to a lot more. Just bring it on. Guaranteed we can at least address part of it. 416-870-6400, star 640 on cell. Dr. Payne Show continues. Talk Radio, AM 640. Yeah, the phone lines are open. You got concerns, health questions, bring them on. Dr. Lou is here to answer those. We talked about the one case. Now, you had something with a shoulder and neck happening as well, right?
One that's probably a lot more relatable to our average listener here, because not everyone is going to have, that was a very complicated case, the last one I spoke of. But I did have another lady that came in to see me. She hurt herself a year and a half ago at work. And in hurting herself at work, she hurt her shoulder. She fell onto her shoulder and hurt her shoulder. She had a couple tears that resulted from there. She started therapy right away. Therapy wasn't really helping all that much, and so she had to go the surgical route. She had surgery, was feeling great, still continuing to do her physio, but then she was reintroduced into work. In being reintroduced to work, and this is one of the things that I often go over with patients, is a work hardening, where you slowly reintroduce someone to what they were doing, because you can progress too quickly and just bring them back to square one. And it sounded like that's what happened. She was brought back to square one. But interestingly enough, her shoulder was hurting, and she still thought it was the actual shoulder that was bugging her. And she had still only been getting the shoulder treated. I took a look at her, and what I actually found was that the problem was actually coming from her neck. It wasn't the shoulder anymore, because the neck, or the shoulder had been operated on, and the ligaments were made stable and the muscles were made stable. And it wasn't that. It was actually pain being caused from her neck that was referring into her shoulder that felt very similar to that original shoulder pain. So she still thought it was the shoulder pain happening, but really what's happening is it was neck pain. And so my recommendation, what I sent her back to her therapist with, and what I talked to the therapist directly about, was she needs to get her neck worked on, and in doing so, that'll help to alleviate the quote unquote shoulder pain that she's having, because you have to look at what's the root cause. Not all the time when you feel pain in a part of the body is it originating in that part of the body. There are things called referral pain and radicular pain, which are types of pains that may be felt at a more distant area. The best example that most people can relate to is, we all know that with heart attacks, you'll start to get pain in the left arm. And that's referral pain. That's it's just something that happens. It's the way the referral pattern happens in the body. But these things happen for even things that are not as, something not as, aggressive as a heart attack.
Would you say most pain, I guess, not a broken bone or anything, but a lot of pain, or the majority of it, is referral pain coming from somewhere else, or the root cause can be from somewhere else?
I wouldn't say the majority. I definitely think it's something that is not looked into enough in healthcare, and that it's oftentimes ignored. We often will assume that the pain that we're feeling must be from that area, so that if it's elbow pain, it must be the elbow that's the problem. And you're forgetting to look at, well, there's, a shoulder above that elbow, and then there's a neck, and et cetera, et cetera. And, the hip bone is related to the knee bone. Like that whole thing is actually real. So I wouldn't say that the majority of it is referral pain. I think there is a lot that goes misdiagnosed as a complaint of that structure, and not realizing there may be a referral complaint.
416-870-6400, star 640 on cell. Lines are open. You got a question for Dr. Lou. We're here to answer them. Some health concerns. You're in pain possibly right now. Listen to the show. Give us a call and see if he can tackle it. Earlier this week, Zuckerberg came out and he said he and his wife are allocating $3 billion to, by the end of the century, eradicating all disease. Now, it sounds good, but if you did a little digging, you'd see the National Institute of Health in the States puts $32 billion a year into research alone of eradicating disease. So the reason I say that is it's like healthcare versus management. And most of it's management. There's not really that many cures. I know that sounds depressing, but talk a little about that.
No, it's absolutely true. I often have this conversation with friends, family, patients, students, that we are kind of misled to believe that there's cures in healthcare. And the vast majority of what we do is just really management of an issue. It's not actually a cure. The best example is if, for example, let's take a bacterial infection. Okay. You get pneumonia. You take an antibiotic. It cures it that one time. But that doesn't mean that you can't ever get it again. Just by the very fact, the definition of a cure means that you would eradicate it forever. And that's not what happens. And with musculoskeletal injuries, the things that we're talking about here related a little bit more to pain management, it's harder to accept that there's no cure because people come in and they're like, it's not getting better, it's not getting better. And they fail to realize that it may never be 100% again. What you have to do is management. And for a lot of other things, we tend to accept management over cure, such as in something like diabetes. Okay. Someone gets diagnosed with diabetes, they're a little more open to understanding that, yes, this is a management issue. I have to have a good lifestyle here. I have to take my medication, et cetera, et cetera. Same thing with cancer. A lot of people go into remission, but they know there is a chance it may come back. So I have to do the right things in order to prevent that. So there's not a lot of cures. You're absolutely right about that. It's more management of health that we have to take part in. And you're absolutely right. $3 billion versus the amount of money that's already spent. Yeah. I think what we're going to realize as we move into the future is that it's not really a question of how do we cure something once it's happened. We're really going to start to move towards how do we prevent these things from ever happening, and having a system in place that does help should it happen anyways. But I think a lot of the things, and we're seeing this every day with the research that's coming out, cancers, all these heart disease, it's not really about is there a way to cure it once you have it, but how can we prevent these things? And a lot of these things are preventable if we do the right things.
416-870-6400 star 640 on cell. Barbara from Mississauga, good afternoon. Welcome to the show. You got a question for Dr. Lou?
Yes. Hi, good afternoon. My question is about hip replacements. I have been told I should have one. Okay. I'm still pretty mobile. I do a lot of walking, so it hasn't deteriorated too much, but I do have the pain element. But it terrifies me, frankly. Mm-hmm. What I need to know is what actually happens. I'm one of those visual people, and to me, I'm seeing that everything is torn off. You cut a piece of bone off. I mean, the whole thing just terrifies me. So what's the actual procedure that happens with a hip replacement?
Yeah, you're not far off. What they actually do is they will actually cut the bone and put a steel, fake hip in there to how old are you, Barbara?
I'm in my 70s.
In your 70s. Okay. So one of the things for sure, I would always say that any type of hip or knee replacement, you should delay it for as long as you can, because there's also a limited amount of time that they're good for. And most surgeons, if you go in there at 40 years old and you need a hip replacement, it's got to be really severe for them to say, yeah, let's do it, because it's only going to last about 10 years and then you have to do it again. So they are...
Well, it just lasts that short, to me, that's a short period of time. So it's only 10 years.
Yeah, only 10 years. And that's why they push it a little bit more on people of your age, right? Where they say, okay, well, the next time we'll worry about it is when you're 80 and we'll see. And so, that's what happens. But I will tell you from experience that I actually had a hip issue from when I was a child, and my hips are already arthritic, and I know that I'll be getting them replaced one day. And I've seen people that have very bad arthritic hips. And again, if it's something that you can manage, a lot of the times with the surgery, it's really to get the function back. Because with a lot of osteoarthritis of the hip, you start to lose the proper function. Surgery should never be an answer if it's just about pain. It should be more about function. And if it's going to help your function, then that's great, because you need to move around, especially at your age. You got to be mobile. You got to keep going. And that's important. So, it is kind of what you're saying, where they're going to cut out a piece of bone and put it in there. I think it's a discussion to be had. I think maybe a second opinion on whether it's something you need or don't need is might be also warranted.
Again, over time, it's management over cure, right? There is no cure. Well,
that's right. Unfortunately.
Except for more cowbell. 416-870-6400 star 640 on cell. Lines are open. Dr. Lou, the Dr. Payne Show continues on Talk Radio, AM 640.
Hopefully there's nothing wrong, but I think it's worth revisiting with your healthcare professional, whoever your doctor was that did that surgery, and finding out if there's some type of imaging or something that could be done to check it out.
Diane, any more questions you got for Dr. Lou? 1-855-55 Dr. Lou. That would be the number anytime. We'll get back to your phone calls here on the radio station, Talk Radio, AM 640. Dr. Payne Show with Dr. Lou here right till 1 o'clock, 416-870-6400 star 640 on cell. Ellen and Bob Cajun, the lovely Bob Cajun. Hello, good afternoon, Elle. How are you?
Good afternoon. It is lovely here.
I bet. You got a question for Dr. Lou? Go ahead.
Yes, I do. In 2009, I had a mastectomy on my left breast because of cancer. They removed all my lymph nodes on that side.
Okay.
And I still am getting such severe pain. They've done an MRI, they've done a CAT scan, they've done ultrasound. I know the surgeon told me after my operation that he really had to dig deep because the cancer had spread.
Mm-hmm.
And the only thing I'm getting from my doctor, she's saying, is they had to cut so many nerves and muscles.
Yeah.
And it's going to take years for it to heal. Is that correct?
Yeah, and I was going to say a lot of the times the nerves, the vessels, they follow the lymph nodes. All those things are there to provide function in the body. And unfortunately, when breast cancer is that severe and they have to take out all the cancer, there is a lot of damage that can be done to other structures that maybe wasn't the necessary intent, but unfortunately was really kind of, there was no choice. It was kind of that friendly fire that they had to take those things out as well. Mm-hmm. And unfortunately, once you start cutting nerve endings, muscles, etc., it does contribute to some type of pain pathway that develops into that area. It's a very, very complicated case for sure when you have that. But your surgeon and your doctor is absolutely right. It could take a very, very long time for it to get better. And the reality is it may never actually get 100% better either, right? So
pain just bends me over.
I'm sorry?
The pain just bends me over.
Yeah, for sure. I don't doubt it. And again, this is where, the subjective nature of pain, right? A lot of people can't understand how something like that could be so painful, but it really is. To Ellen, it's that pain pathway is there. And unfortunately, it's going to cause her a lot of pain. It's going to bend her over, like she's saying. Another thing where, in this type of case, what I would recommend, if you can't get the help from the physical perspective, this is when some type of psychological perspective therapy could help, like a cognitive behavior therapy for pain management, because a lot of it could also be the fact that you're so focused on it. And so you may need some type of psychological treatment, some type of cognitive behavior therapy that can help you to forget about it, to not think about it. And I'm not suggesting that that's going to cure you 100%, but it may help you to a point where you can, at the very least, live with it.
Well, thank you very much.
No problem.
Yeah, CBT is interesting, cognitive behavioral therapy,
Very
and what it can do. I've gone through it and I've used it. And, for the doubters, it's like, wow, you know what, that actually works.
It does work, yeah, for sure. I actually, funny enough, when as I went through high school, for myself, I actually had some social phobia. You wouldn't think of it now, seeing as I'm on the radio and I teach, right? But I did have a social phobia component for sure. And a lot of this mental health stuff, again, there is such a stigma around it. It's hard for people to talk about it. But I think if you can be open about it, talk about it, you can do the right things. And a lot of the stuff behind cognitive behavior therapy is essentially fixing those preconceived beliefs that you have in your brain that may not necessarily be rooted in fact, right? Like the public speaking phobia or whatever, where you think, oh, people are going to laugh at me. They're going to think I sound like an idiot, et cetera, et cetera. It helps you to realize that you put yourself in those situations so that you can see the facts, and no, people are not doing that. Yeah. So you start to get the factual information, and that changes the way you think. And it actually does help. They do a lot of cognitive behavior therapy for pain management as well, because you have to be able to change the way you perceive that. And a lot of the times, just the fact that you're thinking about it all the time is helping to create those neural pathways that we discussed. So for sure, you need to be able to, at some point, forget about it or think about something different, kind of like that saying when people would say, oh, your foot's hurting, let me, punch you in the face. And then all of a sudden your foot's not, that type of distraction does help to forget. And I'm not suggesting that we should, start punching anybody in the face right now, but I'm trying to highlight the point of distraction, and also not thinking about it can be very beneficial.
Well, I found it was a nice alternative, because you weren't popping pills, you weren't taking any outside medication. It was simply through your own practice. Like, you're scared of going in the subway. What if I get attacked? Well, then go in the subway. What's the worst can happen to you?
That's right.
And you'll find out, hey, you know what? God damn it, he's right.
Yeah,
I'm okay.
Yeah, exactly, and that's the thing with the cognitive behavior therapy. Sometimes medication, if you're very anxious, you got a high level that can't be controlled. That's where these things, again, going back to integrative, plays a role, where you can have the cognitive behavior therapy along with the medication, and as you get better with the CBT, you start to wean down on the medication, right? Because that should be the goal, is that you can do it on your own, and that's the beauty about things like the psychological perspective of CBT.
We'll take a quick call before break. Bill in Barrie, good afternoon.
Hey, guys, how are you?
How are
Hi,
you,
Bill.
Bill?
Good.
Is this Bill our emailer, Bill?
Yes.
Hey, Bill.
Yes, it is.
Good,
yeah.
Bill. How are you?
Not bad.
So what do you
Not
think?
bad. So, well, I gave you sort of a breakdown of what's going on, and I'm just wondering what steps I could take to sort of nip this in the bud or make it better than it actually is right now.
Can you tell me a little bit more about what happened? Give me a little bit more history.
2008, pneumothorax. They stuck a tube in my side. 3 days in the hospital. They yanked the tube out of my side. That's when the pain started because for whatever reason, I think that tube had become attached inside my body.
Yeah, tissue would start. With the pneumothorax, I think if I remember correctly, last week you said it was spontaneous, but was there anything leading up to it? Like, or am I wrong saying that it was spontaneous? It's just kind of what I'm recalling here.
Healthy as a horse. Yeah.
Really? How old were you at the time?
Actually, I think you said I was 42, but I'm not. I'm 52.
Oh, okay, sorry.
So, no, nothing at all. Like
so
I was
healthy as a horse.
Yeah.
Woke up one morning and you had a spontaneous pneumothorax. Any
said
history of anything in the family?
It usually happens to guys in their 20s that are tall and skinny, and I am. I'm 6'2" and 145 pounds. So, maybe that's part of it. I don't know, but no history in the family whatsoever.
And have you tried any nerve blocks at this point?
I haven't tried a nerve block. What they did tell me is I have an aroma under my rib, which is true because if I push there, I'll end up on the moon. Mm-hmm. It's painful. So they've got me on painkillers, but I mean that's a Band-Aid solution.
Any type of more integrative approach like chiropractic care, acupuncture, naturopathic, anything like that?
I've tried chiropractic. I've tried that. What's it called? Where they put radio waves inside you. I don't know what it is. They put a patch on you and it puts sonic waves into your affected area.
Okay.
I forget what that's called. Mm-hmm. I haven't tried acupuncture. The cognitive stuff, yes, I've tried that. It has helped a bit.
Okay.
But and it is all the way you look at things. I mean, if you walk around with a black cloud, you're going to feel worse, obviously.
Of course. And even the fact that you said the cognitive stuff I've tried, that type of stuff is not stuff that you tried, stuff that you have to continue with. It has to kind of become part of the lifestyle, right? It's like people that fail at diets just by the very nature that they call it a diet. People are much more successful when it's a lifestyle modification, and that's the way you now choose to live your life. So with that type of disposition, it can't be something that you try. It has to be something that you implement every day. And I could tell you from my own personal experience, it's still things that I may not have to implement as much as I did once upon a time for the social stuff, but I still do at times find myself implementing it if for whatever reason you start to revert back, because we are creatures of who we are, and we sometimes will revert back. So you have to be able to not just try that cognitive behavior therapy, but practice it every day and change on that regard for sure.
Yeah, I do notice when I go out or, I'm out socially that, I feel great, but I can definitely feel that, I'm starting to hurt. So I'm wondering whether it's a subconscious thing.
And that starts the hurt.
Yeah, and that's what I mean. That's my point about where the cognitive behavior therapy and those types of things can actually play a very big role, because then you start focusing on it and now it amplifies and it becomes a very, very vicious cycle.
It's a drag, man, but you can treat it. Yep.
And so you need to find a way to break that. And again, a lot of people can implement cognitive behavior therapy. It doesn't just need to be a psychologist. Sometimes other healthcare professionals will try to help with that as well.
416-870-6400 *640 to call in. You want to call Dr. Lou outside the show? I'll just give you that number as well. 1-855-55 Dr. Lou. Dr. Payne Show continues. This is Talk Radio, AM 640. It is 12:45. 416-870-6400 *640 on your cell to call through and get some answers, some relief, possibly. Mary in Woodbridge. Good afternoon. Hi, Mary.
Hi, Dr. Lou. Thank you for taking my call.
No problem.
I have a question, and if you can help me, please.
I will try my best.
Thank you. On August 11th, I went and I had the DNC, and because they found a polyp and thickening in a lining of uterus.
Okay.
And they call them, I believe, endometrial dysplasia, something like that.
Yep.
And Wednesday, on the 21st of September, I went and get the results from Dr. Say, and he told me it was a cancerous.
Okay.
And that worries me so much because I had a great history of cancer, and I was having melanoma 8 years ago.
Mm-hmm.
And I'm okay with that now. But this one now is really concerning me. So they told me they're going to send my results to the Sunnybrook, and Dr. Osborne, he will call me to go and see and take it from there.
Okay.
And they told me also it's in early stage 2.
Good.
And I want your opinion on this because I'm very, very worried.
Yeah. So what exactly would you? I mean, it sounds like everything that you've done is the right way to go about it. It sounds like that the team that's working with you is doing it the proper way. The fact that it's early and where it is in the body is often a place that they have good luck with in terms of getting rid of it. So I think you're doing all the right things. I'm not sure. Do you have a more specific question? I mean, again, I'm not an oncologist, so this isn't my area of specialty, but for sure it sounds like that everything has been done right to this point. It's caught early, and I think if you get the proper treatment, which it sounds like you are, you should end up, at the very least being fine. And, you've gone through cancer before, which helps with the mental disposition aspect where you know what you're about to face and you've gone through it once. And I think you'll make it through again, as long as everything that you're telling me is accurate in terms of it being early and you're getting the right people to treat it.
So stage 2, you think it's early?
Well, it's not as early as stage 1, but it's not as late as stage 4, right? So obviously, the earlier you can catch anything, the better. But I do believe that something where it's in stage 2 is still early enough, and we tend to have good. Our medical system is really good with those earlier types of cancers, and when they're caught that early. So I think, again, is it as good as phase 1 or stage 1? No, but. It's also not stage 4, and I think sometimes you have to change the disposition, the way you look at things, right? Don't just say, it's stage 2 versus stage 1, but it's stage 2 versus stage 4. That's great.
Talk about that for a minute. I mean, not just with cancer, that's obviously a big one, always, top of people's mind, but mindset and genetics. I mean, those play a huge part, right? Because we always hear that, that woman in Chile is, 117 years old, and it's like, how'd you get to be that age?
Yeah. And it's their mother and father, right? They had good genetics.
It's not the gin before bed.
That's how, and there's something called the 2-hit hypothesis in healthcare, which is essentially that you can have a genetic predisposition to something, and as long as you don't introduce the environmental factor to trigger it, then it shouldn't show up. So the example to that is with, say, something like a breast cancer. You can have a genetic disposition to breast cancer, but if you don't have something in the environment trigger that genetic to show itself, then you won't necessarily have cancer. But yeah, there's all kinds of things. And I think a lot of it that we often forget about is genetics. If you have good genetics, that's going to help with a lot of things. And if you have bad genetics, unfortunately, that makes it an uphill battle. Like I know in my family, it's diabetes and the heart disease. I wouldn't be surprised if one day someone tells me. I'm doing my best at the very least to try to prevent those types of things. And I think that's the key with knowing your family history is where can you play a more preventative role? If you know cancer runs in your family, well, what types of things can you do to prevent cancer? And if it's heart disease, what type of things can you do to prevent those things? And yeah, I think it's important to understand your family history for sure, especially if your parents, your grandparents that have gone through this stuff are still alive, your brothers and sisters. Talk to them, find out like what were their early symptoms, what types of things, because that will help you to understand what the early symptoms for you might be.
Even with good genetics, I think there's something to be said for just living properly, clean and healthy. I mean, we all,
Absolutely.
That story of, the 90-year-old guy who's been choking back 3 packs of Lucky Strikes and never got cancer.
Yeah.
So I'm his grandson, so I won't get sick.
Not necessarily. Yeah. I think really the key to life, and this is my personal opinion, not based on any research, it's moderation. Right? Like you meet a lot of people out there too that are robotic in terms of the way they eat perfectly all the time and exercise all the time. There's people that are running marathons and having heart attacks during that marathon, right? We on the first day we talked about the stress curve, and that applies to everything where optimal function is somewhere in between at the moderate level, whereas too little and too much can to diminish results. So I think it's all about moderation because you have to enjoy yourself too, right? Like if you do like to have cheesecake every once in a while and not having cheesecake ever again, what does that do to your mental disposition, right? Is a question we have to ask ourselves. And then what is truly health? Is health just the absence of physical disease, or is it being happy in life too?
Look at you.
I know.
Too much to think about, son. 416-870-6400, star 640 on sale. Back to your calls after a short break. The Dr. Payne Show. Talk Radio AM 640. 12:54, last few minutes here of the show. You want to get a hold of Dr. Lou outside the show hours. It's 1-855-55-Dr. Lou. What is your email, by the way?
You can contact us at info@paincarecanada.com.
Nice.
Yeah,
Very
and
cool.
again, going back to people with social media, Facebook, Instagram, if you just go into your Facebook and you type in on the search bar Dr. Lou, or on Instagram, you can find me, add me, contact me that way. We also
Brilliant.
share a lot of interesting things that I think people would find helpful.
Helpful knowledge. Got Louis, or is it Luis in Welland? Hey, Louis, how are you?
Hi, Dr. Lou.
Hi.
This is Louis. I'm Lois, but
Lois.
Oh,
Okay,
okay.
sorry, I got to miss. Sorry,
Yeah, we got to spell it wrong
you
here.
can
It's okay.
call me Louis because that's my dog's name.
Okay. Well, it's also my name, so
I'll remember you, Louis.
yeah, perfect. What can I do for you?
Okay, I've started with diverticulosis,
Okay.
and now I guess I have an irritable bowel syndrome.
Yep.
I don't know. The doctor hasn't really checked me out lately, but for some time now I've had a lot of problem with my bowels, and I go quite suddenly, it'll be, but I started taking Align, and I found that was helping me some, but maybe there's something better. I don't know.
Yeah. So let me get this right. They've said that you have irritable bowel syndrome.
Well, he didn't say that, but it has to be something. I don't know. I got to get it checked out
Yeah,
better.
and so it's kind of this touches on the topic we've been talking about all day. One thing that people don't realize about our GI tract is the amount of nerve innervation that we have from there that's related to psychological disposition. And something, a term like irritable bowel syndrome is actually a wastebasket term. Sorry, pardon the pun, right? Because it's a wastebasket term for when there's, in the absence of any true type of pathology, like a colon cancer or an ulcerative colitis, et cetera, there's irritable bowel, and irritable suggests the irritation of the psychology of the person. So people that are stressed in different ways will have a response in their GI tract. It's also fight or flight, right? Like if we were being chased by a tiger 10,000 years ago, the first thing our body would naturally do is defecate to remove that waste so that we could go, right? That's why that term don't poo yourself, just to use the proper term here. But that's what happens. It's so related to the psychology, our bowels, that whatever is going on that perspective will be felt in our GI tract and how that responds. So, we don't have a lot of time here, but I'd love to discuss it with you more if you'd like to give me a call. But yeah, for sure, there's probably a lot of other things going on that may be contributing to this that you probably aren't even aware of.
Yeah, I know that stress will upset me, and
yeah, exactly, yeah.
And I get up in the morning if I eat.
Yeah,
and go out, then the worry is there. So then you feel like you can't make it.
And that's snowballing it. That's precipitating it,
and for
right?
different people, irritable bowel doesn't necessarily mean it has to be, that you have to go. It can also be the opposite of constipation.
Yeah.
Right. And that's the whole thing. There's no true, and this goes back to the individual. How does it affect that individual? It's the same thing as some people who are stressed tend to lose weight and other people tend to gain weight, right? This is the nature of the individual, and that we need to look at healthcare from an individual perspective, not just as a term.
IBS is such a big one, as we mentioned earlier, with CBT, with cognitive behavioral therapy.
Yeah, and a lot of and the whole integrative approach, right? Like even with cognitive behavior therapy, I'm not suggesting the absence of any type of physical intervention.
Right.
I'm saying that it needs to play a component. We need to remember that our health is made up of the physical, social, and psychological, and we need to try to target all three of those things for any problem that we have, because you can have a bad relationship that can be contributing to irritable bowel syndrome, and maybe the key is fixing that bad relationship.
So, and you can deal with that. You deal with a full multi-pronged approach to your clinic, right?
We have a full team of people ready to deal with whatever. That's what I look at. I look at what's the root cause for this person in that comprehensive assessment, and then I make sure to point them in the right direction on how do they get the answer that they need, because too many things are going mismanaged or are being dismissed or are just being missed. And it's time that someone sits down, listens, goes through the whole process and says, okay, here's and I like to go through what have you already done, because if it's not working, then why try the same thing? Like, that's the definition of insanity, right? So let's try to look at the things that aren't being looked at.
Fantastic for another week, my friend. We will be back next Saturday here. Dr. Payne Show, Dr. Lou. Anytime is 1-855-55 Dr. Lou. Make sure you give him a call, and we will return here again next Saturday at noon on the Dr. Payne Show, Talk Radio, AM 640.